Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, if you see the drugs which are causing cholestatic jaundice. So the drugs which are causing cholestatic jaundice include acetohexamide. These are acetohexamide. Anabolic steroids can cause cholestatic jaundice. Then we have androgens. Chloropropamide causes cholestatic jaundice. Then we have clavulanic acid or amoxicillin will cause cholestatic jaundice. Then we have cyclosporin causing cholestatic jaundice. Erythromycin estolate will cause cholestatic jaundice. Then we have flucloxacillin will result in cholestatic jaundice. Gold salts, then methimazole and nitrofurantoin. Oral contraceptive pills and phenothiazines. So these are the drugs which will cause cholestatic jaundice. Thank you for watching.
Thank you and thank you for watching.